I was experiencing back pain, mild back pain. For the most part, I'm just, kind of an office worker, so it would just be uncomfortable getting up, sitting down. So I went to see him to see what it was, and he checked me out and did x-rays and MRIs and determined I had a degenerating disc, but it hadn't herniated or anything like that. His whole philosophy was, if you don't need surgery, don't do surgery, and just see if you can, use physical therapy or medication to solve the problem. Once it herniated, which was quite a shock and an unusual pain, so when I would sit at the desk to work, I'd be in agony. That's when he finally said, yeah, perhaps we need surgery. My father's a doctor and knew him and recommended him, but also other members of my family had used him, and everybody just said he's the best. And they weren't lying. There's nothing to be afraid of. Surgery is really, these people are experts, they know what they're doing. Surgery has minimal risk, and compared to the amount of pain that you're feeling and the amount of things that you can't do in your life, why wouldn't you have the surgery? He did the surgery, on a Friday morning, and outpatient, and I walked out of the hospital and walked home, and by the time we got out of the car and came into the house, the pain shooting down my leg was gone. And I was able to do absolutely everything. I could crawl around on the floor and stand up, sit down, bend, everything for 9 hours straight, and I was fine. Not a single bit of pain. There's no huge rods up and down my back or anything like you used to hear the horror stories in the old days. It's just a small clamp and a couple of screws. The scar in my back is 1 inch, 2 inches long, and it's nothing. Not an ounce of pain, not any discomfort at all, and that's it. It's amazing.